Today's podcast is on chin augmentation. Chin augmentation can be performed either non-surgically with fillers or through surgery using an implant. And this is one of the few cases in terms of an implant that I believe truly it just hands down beats anything you can do with fillers. Fillers don't provide reliable augmentation of the chin. You really need a chin implant to create a projection there that is definable, that looks right. I always say like replaces like. In other words, if you have soft tissue loss, then putting implants everywhere doesn't look right, in my opinion. You need fat grafting or fillers. But when you have a weaker chin, a chin implant looks so much better. It just blows it away. So the first lesson is, hands down, chin implant wins. And this is what we're going to be talking about during this podcast. So who needs a chin implant? Clearly, someone with a weaker chin would benefit from having a chin implant. That is the obvious category. How large an implant? Well, the implant has really got to be something that's not too large on a female, and you can define it by it being just behind the upper lip, along a plane called the Gonzalez-Ulloa plane. You can look it on my website for that. For a man, if I'm debating, I go a little bit more in the projection because a man always looks a little bit better with a stronger chin, whereas a woman, you don't want it to be too strong. The implant is an extended anatomic implant. So in the old days, you used to use button implants, these short little implants that would go in there, where the problem was that implant would not be very stable. So now, for the last many, many years, and since my beginning of my practice almost 20 years ago, I've been using extended anatomics. So I like to call it an entire jawline enhancement or jawline improvement. So it's a longer style implant versus the very short ones. Plus, those short ones over time moved and became problematic. Where does this implant sit? The implant sits over the thick cortical bone. In other words, just at the bottom portion of the chin. And the reason for that is, to tell you a scary story, is that I did a revision chin implant on a guy from, I think, Idaho or something. And when I took out his implant, it was actually sitting over his dental roots, and it was eroding through that thin cancellous bone. So you can't place it too high. It has to be just along the bottom edge of the chin. The implant itself is made of silicone. So there's, I would say, three major categories of implants. There's silicone, there is Gore-Tex, and then there, or also known as EPTFE, or expanded polytetrafluoroethylene, which is a mouthful, and there's Medpor. So I only use silicone, and the reason is so many reasons. But I used to use Gore-Tex, but Gore-Tex over time compresses. So over a period of about 2 or 3 years, it actually shrinks by about 2 to 3 millimeters, which is not good. It's compressible. And also, they're very hard to remove. Medpor is higher risk of infection and very hard to remove. I don't even understand why people would use it. Silicone has a lot of benefits. One is the fact that once it encapsulates over a period of a few months, it's not going to move at all. In addition to that, it's bioinert and it's not resorbable. And if I wanted to remove it, it's easily removable. The way that I put the implant in is I put it in what I call triplanar. So the periosteum, or the lining of the bone on the sides, is an area that when you place it underneath those sleeves, first of all, even when the patient is done with, or once you're done with the procedure, your implant is not shifting. It's fixed. And then I place it underneath the muscle, the mentalis, and then close it in. So it's very, very fixed even before the encapsulation occurs. But I always tell my patients to avoid not only dirty water exposure for 6 weeks to 2 months or so, but also any direct trauma or blows still could theoretically move it, even though the way I place it is very, very stable. Other indications for a chin implant is if the neck is short, it can actually lengthen the appearance of a neck. I always use the analogy of if I give you a glass of water and next to the glass of water I put a shot glass next to it, all of a sudden the original glass of water looks big. And if I put a pitcher of water next to it, it looks small. So it's just relative size. So it can make a neck look better. Even if a lot of people try to do neck lipo and it doesn't work well, I've got a lot of advanced methods of doing neck work, and I'll talk about that in a separate blog about gland removals, submandibular gland removal, deep fat excisions, etc. But suffice it to say, that just the chin implant alone can give the complete illusion that the neck is better. Even I've been in there sometimes where I'm just doing a little bit of fat removal and not much fat comes out, and all of a sudden the whole neckline looks better because of the chin. Or it also makes the nose look smaller. If someone's got a large nose and you can only physically reduce the nose so small, and the chin is there being too small, then it just makes the nose look large. You can only reduce the nose so much. So with a chin, it actually allows the nose to look smaller. Another example is a facelift. About 20 to 30% of my facelifts, I do a chin implant, and because it gives a better fulcrum, it gives a longer neck and a fulcrum, meaning if you think about it, if I'm pulling up the neck, pulling up the chin, then I have now this implant that's giving better projection. I'm pulling around this chin implant, which gives much better lower face structure and better facelift results. So that is another indication for chin implants. So there is a natural question is a chin implant and a cheek implant very similar? In a way, yes, in a way, very different. I do not like cheek implants in general because I think it's a flawed procedure. Over time, they can get infected, they can not be perfectly symmetric, and over time, as we get older, we start to lose soft tissue in our mid-face, and it looks as if we have a cheek implant already. So if you look at someone that looks older, they have a cheekbone sticking out. So people always say, I like my cheekbones, but younger individuals have soft tissue that covers that cheekbone. So in general, I'm not a big fan of cheek implants, but I'm a huge fan of chin implants. I do a chin implant almost every week in patients. So anyways, recovery is relatively short. The other thing that I like to do, there's only two things that cause quite a bit of discomfort in my patients, which are chin implants and otoplasties or ear pinning. And so what I've done is I use a product called Exparel that makes the chin numb for 2 to 3 days. And so there's very, very minimal pain afterwards. The other thing to know is sometimes for about a week or so, there is a little bit, or sometimes up to 2 weeks, there can be a little dysfunction in the way you talk or smile. And the reason for that is that the mentalis muscle under which the chin implant goes can be bothered or irritated until it heals. So I just tell my patients that. And I also have been using something called TXA or tranexamic acid in my facelift, chin implants, or major surgery. And I have noticed a virtual elimination of bruising. Very few of my patients bruise, and if they do, they have minimal bruising. It looks as if they're starting to bruise at 1 to 2 days and 3 days, and it gets absorbed by the week. So I see minimal bruising and swelling with this. So the recovery on gentle is about 7 to 10 days. The stitches underneath the chin dissolve over a period of 2 to 3 weeks, but usually the stitches are not that visible to begin with. They're as thin as a hair and their color of skin. A natural question is, can I go from inside the mouth to do this chin implant? And I don't do that. And there's several reasons why. Number one is I oftentimes do neck work with it. The second reason is that I don't like a dirty mouth. The only time in 17 years I've had a chin implant infected was when I did a lip reduction or lip correction at the same time as the chin. So I think just going through the dirty mouth has a higher risk of bruising. Of infection, which is the thing that will require me to remove a chin implant. Almost nothing else will, because I place it very, very effectively. And also, I like to tuck it under these long periosteal sleeves. And I can't do that through the mouth. And a lot of people say, do you use a screw or something to hold it in? And you really don't need that. By placing it into these 3 planes, there's no permanent sutures in there that need to be placed there. And I also further secure the implant to the periosteum or lining of the bone, so there's no chance of the implant riding over the chin, even during the healing phase. There's so much I can talk about chin implants. I just wanted to give you an overview of why I'm so passionate about it. But hopefully this short description will give you some understanding, and hope to see you in Plano, Texas, which is just north of Dallas, Texas.